Good afternoon, everyone. It is my privilege and honor to introduce to you Dr. Avinash Supe, sir. To most of us, sir does not need an introduction as he has been the dean of our very institute in the past. And then sir was director of medical education and major hospitals of MCGM. A well-known and highly accomplished surgical gastroenterologist, he has headed multiple prestigious scientific associations. Sir is equally well known for his keen interest in medical education and has been the founder director of GSMC Famer Regional Institute at KEM Hospital. Sir has written multiple books and has published more than 300 scientific research articles, a well-admired teacher and role model for medical students and medical teachers alike. Sir has been awarded the prestigious Dr. B.C. Roy Award and ANBAI Award for Eminent Medical Teacher. In my opinion, there can be no better person than Dr. Avinash Supe, sir, to enlighten us on this topic, mentor-mentee relation in research. Sure. Welcome, sir.
Thank you. Thank you, madam, for the introduction, and I think I'm really honored to have madam here, and I think, sure, I think it's the best way. I must tell you, madam, this podium, Sion Hospital मध्ये ना जो आपलेपणा आहे तो तुम्हाला आयुष्यात कुठे मिळत नाही. आणि आय फील मी आता इतक्या इन्स्टिट्यूशन्स बघतो पण जी जवळीक आहे, जे कोलॅबरेटिव्ह कल्चर आहे, एकामेकाला सपोर्टिंग स्ट्रक्चर आहे, दॅट इज द बेस्ट पार्ट ऑफ दिस इन्स्टिट्यूशन अँड दॅट मेक्स दिस हॉल. मी तुम्हाला म्हटलं जशी इथे सरस्वती फुलते तशी इथे आपुलकीची नाळंही बांधते. आता मला वाटतं इथे हे जे सुंदर जे आहे मला वाटतं त्याच्यामध्येच mentor-mentee relationship. When we talk about research, we all go through this postgraduate research, and all of us have multiple in life. Teachers who are not your teachers become your mentors, and that's what we talk about, mentor and mentee. Many of you must not have got taught by many teachers in standard classrooms, but they remain your mentor for your life. So I would like to thank, of course, Dr. Joshi and the conference organizers. So what I would do really is what is mentoring, what are principles of mentoring, discuss approaches to mentoring and role of mentoring in medical research. Now let me ask you a question, who is a mentor? This question comes to our mind. So if you really look into the Greek mythology, mentor was a friend and trusted counselor of Odysseus. And Odysseus left for Trojan War. He placed mentor in charge of his son and his palace, and that made the whole mentoring word started. And if you really look, mentoring is a process of informal transmission of knowledge, skills, social capital, psychological support. And if you really look, it has an informal communication. That means there's a period goes on not only in 1 hour, but it is for lifelong. So you have mentors for lifelong, and they help you in during all the situations of your life. So when you talk about academic mentoring, it is to help you to your professional growth. You know, that is most important. Individuals who early stage of career and promote excellence in teaching and learning and research mentorship. So when we talk about mentor, you know, I never realized this term mentoring till the time, I mean, you know, we all call guru and we always believe guru is, I mean, all we talk about it. Mentor is probably an English term which came from the Greek, but it equals to our guru, where probably there is a much more academic relationship in a mentorship. So it has your own career pathway, like say teacher, advisor, sponsor, coach, protection, exposure and visibility, and challenging assignments. Now to tell you, I use the word sponsor, you know. When I went my first photographic trip to, I think somewhere I went for snow skiing in 1983. So Dr. Bapat gave me his camera with roll loaded and told me, you go take pictures and learn photography. You know, that kind of an sponsorship and mentorship. And you know, Dr. Bapat was my teacher, of course, but he gave me that kind of a sponsorship. So these are the kind of things which make you mentor. Mentor don't happen just because he is my postgraduate teacher. Mentor usually goes beyond that postgraduate teacher in the research. On other side, Psychosocially, he has to be your role model. He has to be your counsel. You can go to him anytime and ask him, I'm not feeling well. This is not working out well. You should be able to free to go. Acceptance, affirmation, confidence, and emotional support, and of course, handling failures. And we always fail in life. Everything doesn't go well. So at that time, if we want somebody to help you handling your failures, that's the time you need a mentor. Why mentoring for PG students who are already medical doctors? You will say me, okay, we are medical students, they are already now doctors. Higher career satisfaction. See, probably medical college is one place where the ambitions are too high. We are never happy with 1 paper, 2 papers, 10 papers, 5 books. I will always want to have 20 books, 300 publications, 400 publications. I want in this particular, any GM. So we have a higher academic satisfaction. Less anxiety and behavioral issues. Better professional expertise you want to give them. Better confidence in handling unexpected. Residence is one who deal with lot of unexpected things. And better output of research. So, when you say I am a successful mentor, as you all, many are teachers and many are students, so we are both here mentors and mentee. We must encourage and demonstrate confidence in your mentee. Now, this doesn't happen. Many times I have seen our postgraduate, today many times, postgraduate teachers, there are some teachers, for me, I was lucky, but many times I find the complaints come to us. When you are in a dean office, you understand everything what is happening in a hospital because too many complaints come. There are mad people will come, teachers will come, students will come, and they'll complain about each other. And then you realize what is happening in that department. And recognize your mentee as an individual with private life and value him as his own person. I think once you start looking at him like that way, and don't look at him as your, maybe I call it as your student or servant, or you are looking as your, don't look at him as a person. Once you start looking at his person, you automatically become a mentor. Don't look at him, you have to do this. Ensure a positive and supportive reserve environment for your mentee. Don't deny your own ignorance. That's another important aspect for a mentor. Don't allow the things to happen in such a way that you are not controlling at all. And be liberal with feedback. Encourage independent behavior but willing to invest ample time in your mentee. The biggest problem today we face in our departments, the seats have become, like say, our department seats have become 24. There are 112 residents. Each boss has 12 students after him. They don't get time to really spend with them. And then the students want to discuss so many things. He wants to discuss his postgraduate thesis, topic, methods, and he's confused. So then what he does, he finds some mentor who is a peer teacher. Or a peer, he finds out somebody who will help him. Because his current boss is so busy in his practice as well as in his teaching, as well as in clinical practice, that what we call as an activity trap, we don't get enough time for a mentor. Now, the first principle of mentor-mentee relationship is that you should give him adequate, dedicated time. Secondly, provide accessibility and exposure to your mentee within your own professional circle. You have to really see that you have to make him part of your whole family. When you call parivar concept, it's very different from the boss and the kind of relationship. When you bring the parivar concept, you give them space in your professional circle. Illustrate the methodology and importance of networking in basic science and allow your mentee to assist you in projects, papers, and research where possible, and be generous with credit. That the last word is very important. When I was writing a paper with Professor Blumgart is one of the top surgeons in Sloan's Kettering. I was his fellow. And he asked me to write one editorial for a journal. It was about how the hepatic resections have progressed. So I did all research and I wrote it. And I took to him, and a typical Indian mentality, I put his name first and put my name second. What he did first, he just changed the name, saying, Avinash, your name has to come first. You have work and you need it more. I don't need it. Look at that man who has international standards so top, and the whole editorial is published because of him. But still he will show that kind of a thing, that I have given your name first. Now, I personally feel a small experience like this really brings down to you and tells you that you have to give it to your students. I understand many times our teachers struggle to get publications and therefore they want to put their name first. But after 20 publications, feel free, put your students first. What is there in publication today? Allow your students to put your name first, those who have worked more. Don't give gift authorships. Make them work, but give them something which is there. That is where your relationship start. Otherwise, there's always, मैंने सब काम किया, उसने पेपर में पहला नाम डाला. Let not that come in your mind. That's where the mentorship gets lost. Then what do you really expect from a mentor? There are some students. Clearly articulate their role. Exhibit high level of time management and commitment. If I don't see a commitment from my student, I don't really develop that relationship. Provide meaningful feedback to residents. Don't just tell them good. Sit with them. Talk to them. Many times I find if somebody is presenting a paper, I just record that presentation. In private, I give him and I'm telling him, this is the way you could improve your communication. Don't tell openly, but tell them slowly. I think and tell him, okay, this is one place where you could have really improved. Give them a constructive feedback. Assist, support and residents' goal and objectives creation and collaborate with other mentors and program faculty. In our medical college, the biggest problem is we have too many people in a particular department. It's not one-to-one. In that case, feel free to have mentorship who has expertise in other area. And if it is done that, then that widens your vision, their vision and your relationship. Now, first thing, what is expectation from our mentors? They should be good listeners. We have to learn to listen. We all are good speakers. We are good talkers. We don't listen to your students. And that is something which we must really discuss and listen to them, to listen to the personal and professional concerns that residents have and provide guidance. So they should be good listeners. Secondly, they should be good goal setters. I really like Madam that, I think Madam said that, but you must really tell you the effort she had taken to develop that 4-year kind of a goal setting was an amazing effort. I don't know how many of you really gone through it, but you should have gone through, and she walked the path as she said. And this is something which is more important. So it's not, of course, that probably has come from her AFMC background and her military background, but that is the point, we should learn from it. That when you become, say, dean, director, or when you go to a higher post, you should have that goal setting path. Same thing, you should try to do it for your mentors and mentees. Do you have a pathway? And many times we get about, say, 5 students. All students are not alike. And I can profile my students clearly in surgery. Some are very quick, they learn much faster. Some of them have a good skills and good hand. Some are good in theory but don't have a good hand. And some neither respond, they are dumb, whatever you do, they are not likely to improve so much. Now, once a resident comes to you, you should have a clarity in thought. Can I make this resident as an excellent kind of a person, or I have to just make him safe practiceman? And in the same kind of a person, you may have a different goals. And okay, and then many times you find, if you are going to spend your energy and time for everyone in the similar way, ideally you should do that, but it doesn't happen because some people will not absorb it so much and some people will absorb quickly. So then give them higher goals, work outside the circle. Then only you will create mentees who are excellent. Otherwise, your energy gets wasted as a mentor. So try to be a good goal setter based on his ability, learning style, what is his capability, and where you can really turn him from where. And that's the classic of a good mentor. Another expectation from mentor is he should be a good evaluator and a problem solver. He should solve your problems. Don't create problems for you. Many times if somebody I go to a boss, he should give me a solution. He should not really make me revolve around again and again. Go to this class, go to this place. I mean, that's not solving my problem. You have to solve your problem. And that is something we expect. And he should also evaluate me. Collaborator and scholar. Mentors work together to enhance the quality of medical research by continually striving. He himself should be a scholar. He should be in a person who can collaborate with people. Now, once we work with such people, automatically the people start working with you. I just want you to think in your mind, what are the qualities which you learned from your teachers and how they influenced your work. Automatically you will get all these answers. And if I look back, I find out so many my teachers gave me so many different qualities. Maybe they may be fighting with each other, but ultimately they gave me those qualities which made me different than what it was. Looking from the mentee side, eagerness to learn and respect, desire to learn from the person selected as a mentor. You should have seriousness in relationship. Remember, mentorship and mentee is a serious business. It's not something where you just have a cup of coffee and have a lunch or dinner. It is something where you're creating a path for yourself. So mentee should be very serious about this. And especially at the beginning, be polite, insistent, because you desire for an active mentor. And of course, you should be flexible depending upon the senior professional's schedule. You know, I think it's very interesting to really see what happened. Again, I would like to give example of Dr. Blumgart. When I wrote to him, he said, come in the winter. Winter, there are not many fellows. You will be the only person. I'll be able to devote more time to you. That is his letter. So I went in winter in New York, walking every day through snow. But those 6 months were the best period of my life because I learned one-to-one from a mentor. So look at these kind of aspects we should do. Of course, you should be prompt, you should understand feedback, interest in your professional journey, and never forget the time and effort of this person is taking to offer you a smoother pathway of success. What are the guiding principles? The first thing you should ensure as a mentor-mentee is emotional safety. I should be able to go and talk to that mentor when I feel emotionally safe. When I'm entering, I should not really feel he will fire at me, he'll do everything. No, emotional safety is the first part for a mentor-mentee relationship. Secondly, responsiveness. Responsiveness is something which, we started one new initiative called as a CARV initiative. When we started ATCOM, madam, we started with one CARV initiative. Care, attitude, responsiveness, values, and all this. So I think these are some of the, if you really go through the ATCOM booklet, we have written inside this sensitivity and responsiveness. I think what we need to teach our students is the sensitivity and responsiveness. See, today also, I know how we learn it, and I must tell you how I learned it. Once I was traveling with one of my sister, and she was a gynecologist, and there was a pregnant woman who came. And I did not get up from the bus, from my seat. So she hit me and she gave me, no, whenever a pregnant woman is traveling within a bus and she's standing, you cannot sit. Simple lesson. Today also, if somebody comes to you, you need to stand and give her a sit. That is responsiveness. If you are not able to respond to these small situations, even if it's your mentor or mentee, you have to first learn what is his state of mental mind, how I'm going to respond to it. If I'm going to respond it well, probably that's the way you should really start learning. Then informality, independence, leadership role, and role modeling. I'll come one by one. So emotional safety, as I said, realize mentee learn by making mistakes. Tell me who has not done gross mistakes in the residency? I'm sure we all do it. It's important how your senior registrar and your boss reacts. It's very, I'm sure all of you work in a very critical area like ICU, surgery. We make mistakes. It's important how your boss takes care not to prevent them, and once it happens, how he takes care and how you make your whole theater emotionally safe. Now that is most important for a mentor. Then alleviate mentor fears that making mistake can lead to overly harsh repercussions and humiliation. Otherwise, you cannot create a teaching or research environment. If you want to have a teacher's research environment, you have to create emotional safety first. And of course, give time, tolerating it. Sometimes frustrations do come in our operation theaters or in our day-to-day practice. Many times I've sat in OT outside holding like this, okay, we have lost the patient, there's too much of bleeding. It does happen. What is more important is sit down, go back, find out what went wrong. Each step you find out and try to get that feedback and put it into the system. And that is most important when you talk about mentorship. It's not only about firing somebody, call him, oh, you have done this badly. No, that's one way aspect you want to do it, administratively you do it. But if you are to be a mentor, you try to see how I bring that kind of a change in this. So responsiveness is something which is all this clear, honest, timely, detailed, culturally responsive mentoring, what we call today. You know, all over the world today, there are two things which have happened, what we call as a cultural multi-diversity. One is a gender equality, and the second is diversity. Today, even all international programs, internationally also, will try to see that you have adequate number of people from all the continents, and you give respect to the every part of the community. Now, this is something what we call as a multicultural diversity. If you understand this, you will be able to do responsiveness. Don't leave them alone. Trust, empathy, encouragement, and positive attitudes. Respect your people, even if he's anybody. And you know, you should start respecting every mentee of yours. Many times, you know, you will learn from him many things which you otherwise would not have learned. Today also I tell you, there are so many of my registrars have taught me so much. They know everything new. They learn the new technique. They keep you updated. They are the one who will talk more about AI than what you know about it. And these are the people, you should listen them carefully. Learn best from them. That doesn't spoil your relationship as a boss and teacher. Your mentor-mentee relationship still continues. So give respect to them, learn from them. Informality is something which many people like, especially when you are a mentor and mentee. Independence, leadership role, and role modeling. Now, these are the four things which you will find. Today, unfortunately, what has happened today, our 10th and 11th curriculums are purely spoon-fed curriculums. You know, we don't really allow students to open up. And when they come to our place, we probably just allow them to, in the first MBBS and second MBBS, they are looked after very well. Looked after, I'm saying. When they come to the third MBBS and fourth MBBS, they are left open. Nobody, त्यांचा कोणी वाली राहत नाही, to be very frank. ते क्लासेस एक बाजूला असतात, बंक करतात, येत नाही, कोणी अटेंडन्स घेत नाही. बऱ्याच ठिकाणी I have seen, there are some teachers who sincerely teach. But many places, students are left open. Students many times get confused. There is nobody to really think. Now, this is where you have to really connect with them and also give them some kind of an independence. Now, when we talk about effective mentoring, it is commitment to regular and systemic dialogues. Then mentor and mentee respect each other and trust and transparency. And many times you give agenda to the mentee if he is capable. So, who is an effective mentor? Who is a good interpersonal skills, approachable, has empathy, open mind, flexible, supportive, does not control, good professional skills. He should be a good surgeon. You can't, if you are a very poor surgeon, people will not follow you at all. Knows organizational routines, offers a new perspective, and has his own focus. So, journey where both embark together to arrive at a common destination. You know, one of the one of the important part of our relationship, I'll tell you, those were my registrars in somewhere in 80s and 90s have become now big bosses. Because you know, today he may be mentee, but tomorrow he is going to be my colleague. And sometimes he may be my boss. So, we have to have that mentorship relation very clearly written. Mentor has a genuine desire to see that the mentee succeed to find out the best way to reach whole. And maybe lifelong sometimes can be mutually beneficial. And when your own registrar calls you after 30 years and asks you for advice, and we work together, I think that's the best mentor and mentee relationship you can have. And if that kind of a faith you are able to develop, you know, that's where the mentee would do better. And there are benefits to be a mentee rather than a student. You know, point of personal contact, you always have somebody to go there, ask any question. If I'm in difficulty, I'm going to ask. Today there are digital mentees, there are AI mentees. I don't know how many of you really gone through all this. There is an AI mentee now. There's an AI, so I can ask him anytime. But these are mainly information here. The emotional support, They are coming out with those emotional mentees who would give you, but then they look currently what their mentees are, they are not up to that level. So the human aspect has to be really preserved in this mentee system. A critical friend, a focused regular meetings with specific issues, a chance to explore teaching and learning, and a smoother time. Today also, if I have to write a difficult paper, I write to my mentors across the world, and I can tell you today also, even if some of my mentors are 80 and 85, they will write me back and tell me, Avinash, you will find this literature here, and they will send me a paper. Now, I think this kind of a relationship is something which is always better. So there are phases in mentoring. Mentor recognizes abilities and weaknesses of your mentee. So you first, when a student walks in, within the first 15-20 days, you realize what are his strengths and weaknesses. How many of you, when a new resident comes to you, you first realize in 1 month, okay, what is his strength and weakness? Most of us at this particular stage are good in recognizing people. The second stage, you need to know which are areas of intervention. Some people are not good in communication. So what you do? In a small group, ask him to present, ask him to read, help him to improve his communication. He is not a good public speaker. Send him to a public speaking class. Or give him training. He is not a good writer. His language is poor, but his understanding is good. He is a hard worker. Sometimes, his skills are not good. He has not worked more. Many of the students who come to you from the many sectors, and you ask him, what have you done in your MS residency? They say, sir, we have done 1 hydrocele, 1 hernia. I have not seen any major operation. Now, how do you put him into our cycle where every day there is a 25 list and so many complex operations? So now this is where you are going to look at his skills. Now this is where you need your interventions. Mentee inspired and responds. Now that is the third phase. If the mentee inspires and he responds, you are very happy with it. You are going to take him further. Some of them don't respond immediately. Some of them go into deep. You know how responses of residents are. The next phase is both explore and deepen relationship. You know what is give and take of, that. And then the relationship matures and both grows, and then slowly allow the mentee to go independently. Walk this path. Whenever a new student comes to you, try to go through with him. And it's not necessarily student, your colleague who is coming to you as an assistant or who is coming in your department, walk this path with them. You will automatically find, and if you manage people very well, you become successful kind of an even administrator. Forget about a teacher. And this is something we do. So there are old and new mentoring approaches. This was a very interesting paper which came. Previously, mentor used to select one mentor, one-to-one only, career-oriented, mentor teaches mentee, for young faculty, long-term, hierarchical and same. Today, it has completely changed. Today, I would like to have multiple mentors who are experts in different fields. When I'm doing a project, I would like to have a particular person in that particular field to help me for that particular area of that project. Fair enough. If I'm doing a project and I have 6 mentors, I'm absolutely happy. And pair of groups, specific goal-oriented, variable terms, peers and juniors too. Mentoring is not dealing with underperforming individuals. Taking on problems and work of mentoring. That doesn't mean as a mentor I should write his whole thesis. Don't do all that. Many people do it. मैं लिख लेता हूँ तुम्हारा thesis. Don't do all that. Promoting and sponsoring and protecting mentee. Today I think all ChatGPT does for you. So successful mentoring means sharing the responsibility. Don't leave him alone. Try to share responsibility with him. I would like to give this classic example of Arjun. Arjun was a good mentor. In our mythology, there are n number of stories. Daumya and all those. If you really go through, there are about 15 or 20 stories of mentor and mentee, what they call as guru. Even Santa and Bhangmay, guru is one of the best things. But Arjun is a classic example. Arjun went through training all over. He had mid-term fellowship, he went to internationally, he went to Indra, he went all kinds of fellowships. And he was the most expert. But when it came for fighting against Kauravas, he could not do it. He says, oh, I can't do it. So he required a mentor, and that was Krishna, who guided him how to fight. So in spite of all the expertise and kind of thing, he required a mentorship. So you have to have a mentor who will guide you. Many times in your life you will get stuck. So it's better to have mentor-mentee relationship which will help you to do this. Fortunately for me, I had many mentors. I have not shown many pictures, but I had many mentors in my life. And I can tell you these were the 5 who I have just given pictures, but these people have been more than to me a teacher. They built my not only career, but every stage of my life. They have come and helped me to grow. And this is what mentorship is. You know, I mean, whether it's my hobbies, whether it's my any happiness, illnesses, any kind of thing, they have come, they have helped me to go beyond this. And this is something a mentorship relationship you should have. Lastly, I would say, I'm sure we'll talk about Dr. Snehalata Deshmukh. She was a mentor. No doubt she was a mentor. I was her student. I was her houseman. She taught me holding my hand. She taught me surgery. But more than that, till last so many years, maybe more than say 40, 45 years, whenever I became dean first in Sion Hospital, she called me first and told me, Avinash, you are going to Sion. And we had a talk for half an hour and she told me, this is what Sion is and this is the way you should behave. And many times in every stage of my life, she talked to me. Now that is mentorship. And you know, madam had her own style. मॅडम ज्यावेळी बोलायच्या ना, त्यांच्या बोलण्यातून एक आपलेपणा यायचा. त्या बऱ्याच वेळा कविता किंवा पुस्तकातले उतारे द्यायचे, त्यावरून ते किती त्या वयातही अभ्यासक होत्या ते दिसून यायचं. आणि त्या योग्य वेळी योग्य सल्ला तुम्हाला देत असत. आणि वेनेवर यू गो टू हिम, शी यूज्ड मॅडमना जे आवडायचे त्यांना ते खूप आवडायचे, ज्यांना ते नाही आवडायचे त्यांचे मॅडम she used to be against them. But janna te avdaiche, where the mentor-mentee relationship is there, she would definitely take you much further and she would give you advice at any stage and any part of your life. And this is something which I think madam had that quality. I'm sure we'll miss him. And what I personally feel ki आयुष्यामध्ये असे जसजसं आपलं वय वाढतं तसतसं आपल्याला ज्यांच्या पाया पडावं असे जे मेंटर असतात ते कमी होत जातात. आणि मला वाटतं मॅडम गेल्याने मला वाटतं ते 2 पाय नक्कीच कमी झाले. आणि दॅट इज द व्हॅल्यू ऑफ अन मेंटर. अँड आय पर्सनली फील मॅडम विल मिस यू. So to summarize, mentorship is a relation between 2 people where mentor provides advice and guidance to their mentee to help them grow and learn and develop professionally and also personally. Many times I've seen, I'm sure in your life there is somebody who is a mentor and you would call him in cases of difficulty. When the world is talking against you, the person who talks for you and with you is a mentor. And that's what you should develop in your life. And that's where I think, and I'm sure mentoree can do anything. What I will stop here and say that I was probably lucky to have a mentors in my life. You also try to be, whenever you are doing whether research, whether you are doing your careers, when you are doing your practice, you definitely would like to have a mentor-mentee relationship, because that makes you rich. Not, I'm saying academically rich, that makes you satisfied and even able to achieve much more. So thank you very much, and I'm sure I can take few questions.
Thank you, sir, for enlightening us about the mentor that is beyond PG teacher, constructive communication, communicator, listener, and you have given us the new approaches also. May I now request our chairperson to conclude the session?
Thank you, sir, for a wonderful learning opportunity from you. Sir was here as dean and sir was our director also. And during his tenure, he was, and he still is our mentor, I will say one of our mentors. Sir has taught us in his very lucid language how it was previously, how the mentor-mentee relationship, and now how the mentor-mentee relationship is there. I think we should also, sir has said, we have to include AI also, AI. But, any app we open, there is information, but that is not including the emotional part. So for that, human mentor is required. One should have not only one, but many mentors are required in many fields. And mostly whatever important points sir has told us, it is not only related to your academic career or academic teachings, but the mentor-mentee relationship, it will be in all areas and it will be long-lasting and continuous. So thank you very much, sir.